Tammy Hensrud, Informative Speech on Thyroid Cancer for Professor Hodge. My outline. Notes. More notes. And some research materials. Many of us probably know that we have a thyroid. Most of us might not know exactly where the thyroid is or what the thyroid's function is. The thyroid is a small butterfly-shaped gland that's located below the larynx, which is here, below the Adam's apple, and it is made up of two lobes, a left lobe and a right lobe. And it is connected by an isthmus. The function of the thyroid gland is to take iodine, which is found in most foods that we eat, and convert it into thyroid hormones. These thyroid hormones, known as T3 and T4 cells, are used to control the metabolism. That means that they convert oxygen and calories into energy. If these T3 and T4 cells or hormones are off, that usually indicates that there is a thyroid condition. The most common of these thyroid conditions are hyperthyroid, which means that the thyroid is working too fast, usually results in very fast weight loss. The other extreme to that is hypothyroid. Hypothyroid is when the thyroid is working too slow. This usually causes people to gain weight quickly or have a hard time losing weight. Treatments for these thyroid conditions usually are the use of a synthetic hormone such as Thyroid or radioactive iodine treatments. Now, the downside to radioactive iodine treatments is that radiation is one of the main causes of thyroid cancer. Thyroid cancer, there are 4 types of thyroid cancer according to Memorial Sloan Kettering. Papillary and follicular thyroid cancers are the most common, and they make up about 80 to 90% of all thyroid cancers. It is very treatable because it grows very slowly, so it has a very high success rate for treatment. Medullary thyroid cancer is less common and only found in about 5 to 10% of all thyroid cancers. It is not as easy to treat, but is easier to treat if it is found before it spreads. Anaplastic thyroid cancer is the least common, very rare, only found in about 1 to 2% of all thyroid cancers. It is very difficult to treat or control because of the rate at which it grows and spreads. So, who do we say, or who do we think is most at risk for thyroid cancers or conditions? According to the Mayo Clinic, women are at the highest risk for thyroid disorders and thyroid cancers. Others who might be other risk factors are, or may include your family history, age, race, even certain inherited conditions. Thyroid cancer can be treated in several ways. One, first and foremost, is through surgery. You can have surgery to remove either part or all of the thyroid, depending on which part of it is diseased or damaged. There's also hormone therapy and, of course, radiation and chemotherapy, which are for more extreme cases or those that have spread or grown at a more rapid rate. So what can we do to prevent thyroid cancer or thyroid conditions? We can start with a healthy diet. A healthy diet is always a good way to prevent any kind of disease. The use of potassium iodine tablets is also another preventive measure, and of course there is also preventive surgery. The body in some people produces a defective RET gene that would make the thyroid gland appear that it's healthy when it is not. So some people may opt to have this RET gene removed. The thyroid is one of the body's most important glands. So of course regular checkups of the thyroid is actually the best prevention. So early detection would also be one of the best treatments. Thank you.